It was outstanding to win the award, and two issues spring quickly to mind. Firstly, this project was funded by Quilt, which is, everybody knows, a centrally funded group who fund innovative teaching and learning projects. And for me, it just highlights the importance of ensuring that those funds remain available, because it just shows you what is possible if the resources are made available to departments doing this kind of project. And secondly, it was a great feeling to be there representing Wales. Within the last 20 years, there is now a whole new field known as dermatologic surgery. So no longer do we have the old-style dermatologists just writing prescriptions. We are all actually actively involved in surgical procedures. But how do you train people in order to make sure that they have the skills to do these procedures? And this is where the bottleneck comes in, because in fact, if you consider the old style of training for surgery, it's a one-to-one sort of apprenticeship model, which is, based on very limited resources, which means you can only potentially train very few people at any one time. So this technology is sort of not a minute too late, as it were, because it allows us to bring a whole new area and a whole new level of training to a much wider audience. So now we are able to show these procedures not only in-house, but to people who are on our training courses all over the world, and even further afield, people who are not on our courses but in whom we like to do collaborations with. We can now have this sort of exchange of knowledge taking place. Of course, the idea that you have anytime, anywhere access is brilliant, because not only can you see these procedures, but you can see it not only from the hospital or from the university setting, you can see it from your home, on your home computer. So the anytime, anywhere access, which is sort of the whole revolution of modern education anyway, is another key benefit to this. And as somebody who does surgery myself, I think the idea that you can pause and rewind a procedure is very important. When you're in a theater observing a surgeon, you can't ask him to, could you repeat that stitch or whatever. You can't do that. Whereas if you're observing video, obviously you can pause it, you can rewind it, and that gives you the ability to learn at your own pace. The key benefit for me, however, is the fact that I think learning has now become very democratized, because people who would never have the ability to observe these procedures now do. So I call that the democratization of knowledge, which for me is really the benefit of using the internet generally for teaching and learning.